Okay, water safety, first of all, is an approach by the World Health Organization, and it's really developed out of a recognition of certain best practices among utilities and other agencies responsible for water provision that have been identified as being successful and useful. These have been packaged into 11 modules, and that modular systematic approach is what's being promoted as a water safety approach. Okay, so as I mentioned, it's a process, and this process follows a system of modules. Now, water safety planning will be manifested differently in different areas, depending on the type of utility, depending on the physical location, depending on whether you're looking at it from the basin, from the treatment, from the catchment system, or whether you're looking at it at a national level. The same approach used in different places will be manifested differently. But ultimately, even though they don't look identical, what it should result in is an improvement in the quality of water and the safety of persons consuming that water. Now, our water safety plan in St. Lucia was developed around the Dennery area. Now, CEHI has been involved in water safety planning in different areas. First of all, there was a project that we undertook in Guyana, and that was our first attempt at looking at a water safety plan. Once we got to St. Lucia, we tweaked some of the experiences that we had there, and this led to a much more in-depth approach, which yielded a lot more results, which we're going to share with you. So there's the water safety planning approach, which I'll talk about very generally, but then very specifically as our findings when we try to implement that in St. Lucia. In St. Lucia, this was done in the Dennery, Mabia Valley area. Now, the water safety plan approach looks at our approach for looking at this in Dennery was to look at a very specific area. This area had surface water which fed into treatment plants for that whole area. The WSP looked at the Dennery village and the neighboring Mabia Valley. Those two areas were fed by 4 surface supplies, 4 small rural supplies. Now there's a difference between the rural supplies and the urban supply. In the north of the island, you have water which is abstracted in the Millet area. It goes to the Tibbles treatment plants, and then it's distributed through Castries and beyond. In the south of the island, well, the rest of the island, which we'll call the south of the island, we have smaller individual supplies which are not as sophisticated. And Dennery was selected because it was identified locally by local counterparts as being one of these areas that required specific attention because they experience a number of very particular issues. Supply was a problem. Supply was not able to keep up with demand, so there were shortfalls in the availability of water. The quality of water was another issue. The terrain, in terms of being able to manage the water, was an issue. The population size, the fact that the population expanded in a relatively short space of time without the supply being able to keep up. So there were a number of issues that were able to help highlight the importance of water safety planning. So the area serviced approximately 10,000 people, and one of the characteristics of water supply in that area is that the system, the infrastructure was very fragmented, very old. So it was almost done in a piecemeal fashion starting, I think, back in the 1960s. Okay, this just identifies some of the lead agencies that were involved in the St. Lucia pilot projects. Funding for this largely came from the U.S. Centers for Disease Control and Prevention, the CDC. They provided the funding and some of the technical expertise. CEHI also provided some of the technical expertise and a lot of the on-the-ground interventions and leading the whole process. But we also had WASCO and the Ministry of Health as two of the other major players in this whole process. Now, based on the water safety planning approach, one of the first things you do is identify your national team that's going to start initiating. And your national team normally is made up of persons who have some decision-making power. So they have the power to initiate some changes that will result in what you want to see, which is improved water quality. But beyond that, Module 2 looks at identifying or being able to describe the system. Now, in describing the system, we identified a number of challenges and vulnerabilities. Now, some of these have already been highlighted and will be highlighted later on today as challenges that WASCO experiences all the time. Issues related to land degradation and pollution continue to be an issue. Investment, the low investment, the high infrastructure costs, these continue to be issues. The types of terrain that you have to deal with. Some of these intakes we had to hike to. In one case, I remember I literally had to crawl. Okay, so it's not easy for people to actually go into forested areas. And when we're talking about dennery, there are particular things you have to look out for. And have to literally, without the use of equipment, be able to manage maintenance of some of these intakes. And if you add to that the fact that manpower is generally poor, generally weak, that becomes another issue. So what this does is to highlight some of the vulnerabilities, what makes managing safety a problem. So quite apart from some of the physical, the infrastructural problems, the high unaccounted for water, which could be a problem because of persons tapping into the system illegally for agriculture and for domestic purposes, apart from persons just not paying for water because they're not satisfied with the quality of it or the reliability of the service. And quite apart from the low investment, you also have natural hazards, which impact on the ability of the utility to provide safe drinking water. The droughts and then the hurricanes that we heard reference to extensively this morning also identify particular issues. During the drought, of course, water is just generally not available. So there's increased rationing in areas where you already have low supply. When you have hurricanes, there's always the risk of losing infrastructure because landslides led to loss of pipes, loss of pumps, and that interrupted the supply again. So even though there was more water available in nature for a short period of time, you still had no water in the tap. So people basically had to resort to the same things they were doing when they had no water during the drought earlier in 2010. So this just serves to highlight that apart from natural issues, natural hazards, you have man-made hazards, you have poor planning. Sometimes you have persons who start to build in sensitive areas. You may have agriculture taking place, especially pig farming, which is becoming a serious issue, taking place in areas upstream of water abstraction points. Unaccounted for water, persons infiltrating or tapping into the pipes can lead to contamination. So there are a number of factors which will impact on water quality. So remember that we have to keep looking at this from the perspective of natural hazards and climate change and climate variability, but we also have to look at what people do in the watershed and at various points along the water system. So that may be, there may be incidents where persons are doing things in the forest, whether it's a riverine, it's poisoning the water for crayfish just before June Creole, which has happened a few times. It may be persons building because there's now an access road for one reason or another, and then they start to put houses. There are septic tanks that can flow into the water supply system. But then there's also the hazards, the landslides, the droughts, and other activities that lead to siltation and impact to water quality. So what that does is it reminds us that not all of this falls within the domain of WASCO. WASCO deals with what comes from their intake and then to distribution. But activities that fall within the gambit of Water Resources Management Agency, Ministry of Forestry, responsible for forestry departments, and planning, for instance. These agencies also have a role in what happens. The activities of farmers, the activities of people who use areas recreational. So to shift away from what we were saying this morning, everything about water in St. Lucia is not only about WASCO. And it's not just about consumers. There are agencies that have roles to play. And we're going to be looking at that in a little bit more detail later on. Okay, so I made reference to the modular approach. So this is just what it looks like. And this is available online. This is what water safety planning will involve. Assembling a team, describing the water supply system. I'll do that in a little bit more detail. Identifying hazards and risks. Very important for knowing what it is you're dealing with and then how to correct it. So most of these are to follow on how to deal with those, how to improve them, how to make sure that your improvement is working, how to monitor, when to go back and review water safety plan, because it's not a static document. As you make changes, as you decide that, as you discover new hazards, as you discover new risks, you need to continuously revisit your water safety plan to make sure it remains relevant. Okay, in module 1, what you have to do is assemble your team. Now, generally what we advocate is not necessarily creating a whole new body that's going to start dealing with water safety planning. Oftentimes, you already have some sort of national body which has a focus on water or water-related issues that can fulfill that role. You notice that we have Water and Sewage Company at the center, obviously, because they have a major role to play. But you also have a ministry responsible for physical development, which gives permissions for certain types of development in certain areas, and that's important. You have your communities, the recipients and the persons who most likely engage in activities that can impact on water quality even before it gets to us, very important. Now we have a Ministry of Sustainable Development, which seems to encompass a lot of your water-related agencies. So all of those are the agencies, government agencies that had a role, a central role with water, now housed in one ministry, so they would have an important role to play. Private industry, and particularly in the context of Denry, the farmers. Agricultural, arable farming, as well as pig farming. They have a very, very important role to play. And then you have external agencies like CEHI, like the CDC, and whatever other agencies can provide support, like CWWA, COATA, whether it's training people, it's creating awareness, exposure. These all play a role in assisting and being able to provide support for the water safety planning approach. Now, the Ministry of Health occupies a small box there, but perhaps should have one of the bigger slides. Ministry of Health is very important because they're the overall regulator for health and safety. So whereas WASCO can look at what happens from the abstraction point, storage, treatment, distribution, and there's a role for water resources in terms of managing, knowing what's going on, how much of the resources available, what's happening in their area. Forestry likely can identify areas where you're not supposed to do anything because there's water that needs to be harvested for consumption. Physical planning, which will demarcate and emphasize that there's some areas where you should have no development. Anything that happens anywhere along that gambits, all the way down to the consumer and beyond the consumer, still falls within the realm of Ministry of Health because they have the legislative power to stop any activity that can impact negatively on human health. Okay, this just shows, and I won't dwell too long on this, it really shows the relationship between WASCO and some of the other agencies in terms of their functional roles and responsibilities. So the Water Management Agency, the role of the National Water and Sewage Commission, private operators, Ministry of Health. Again, Ministry of Health, it's written small because it's very compact, but their role is very significant. And I will keep highlighting the role of Ministry of Health. The Board of Directors and the relationship to other government institutions. So this is really just to show, to emphasize again that the role of WASCO in providing water is not simply they do what they want. They are accountable in terms of service to service standards are set by the Commission. Health standards are set by Ministry of Health. The availability of the resource, how much of it is available, how you plan, how you manage, how you deal with things like drought situations and so on. Water Resources Management Agency, among other things. But this just serves to highlight that water is not only about WASCO, and all agencies need to be mindful of that. And part of assembling your team is to identify what the roles of each agency is, what their mandate is, what their legislation is, and what they're able to bring to the table to make sure that at the end of the day, they support this process. Let's skip over that one. Basically, just lists in a little bit more detail the functions of the team. Now, Module 2, and I will go into a little bit of detail in the first few modules, but we won't spend as much time on all of them, maybe the first 6 or so. Module 2 focuses on the description of the system. Now, that's important because we take it for granted that you know what you have, but in going and trying to map out what the situation is in Dennery, we found out that we really were not connecting a lot of the dots. Part of the description focuses on the schematics. Generally, what type of system you have. You may have a very complex system, you may have a very simple system, but you need to know what are the steps and stages involved. What is the process? Mapping the process. Okay. Some of these symbols are a bit small. It's fine. But what it essentially shows is identification of things like abstraction points, pumps, the distribution system, where you have things physically located. During the system description, we focus a lot on things like mapping, demographic data, climate data, and linking all of these together so that you have a picture that allows you to be able to make decisions, to be able to forecast, to be able to identify hazards and risks, priority areas for interventions. Now notice that that last diagram, that last photo, bottom right, I'm not sure if you can see very clearly, but this looks like little spaghetti lines. I think that was taken in Olio. Now you notice that these little PVC pipes carrying potable water to people for consumption is running next to a drain. Now I'm not sure how many people are familiar with Olio, but in Olio, you don't have a lot of depth in terms of the soil. So septic tanks, there's no central sewage system there, as in most of the island. So people rely on things like septic tanks. Septic tanks are not effectively, not efficient in places like Olio because of the soil is very thin. So basically, you don't have a lot of attenuation. What happens in the septic tank system is that some flow through the soil allows for natural attenuation so that your bacteria is broken down, is rendered less harmful. You don't have that taking place in Olio. So you almost have raw sewage running through drains. Now imagine a scenario where you have rainfall, heavy rainfall, you have water levels elevated, you have all of this sewage running through, and you have these lines running right along these drains. Now these appear to be off to the side, the areas where they actually run in the drain, right on the side of it. Okay, nobody thought that that was an issue at the time, clearly. But if you have any breakage in those pipes, you have sewage going straight into those pipes and straight into somebody's room. Okay, so that's what that water safety plan does. It helps to identify where some of these hazards exist, and then for you to start looking at what you need to do to correct them. In the context of other issues, how do you prioritize that? Corroborating that with epidemiological data to find out what impact it's already having. Okay, and then how you go forward deciding how and when you're going to invest, or whether that becomes the first thing that you deal with, or whatever other interventions will help to make this a safer situation for persons. Okay, so part of the description also focuses on, like I said, mapping becomes a big issue. You need to identify, like this bottom map shows contour lines, so you can see how steep the terrain is. It gives you a visual picture. And this is taken straight from the water safety plan document. You look at this and you can get a snapshot of what you're dealing with. Very steep terrain, so it already tells you some of the challenges in terms of laying pipes, expanding, extending, maintaining these systems. The first map I think there's one on census data. So it identifies where your hotspots are, where your denser populations are, where you have expansion. So once you start adding your demographic data to that type of data, to projections for growth, to expansions, you start to realize where you need to put investments. Again, your system description within your water safety plan is a good planning tool. So quite apart from identifying issues related to water safety, it becomes something that you can use for overall planning. This one identifies epidemiological data. Okay, this is actually a very small diagram, but what it does is that it represents 14 years of data collection related to water quality. I think this one focuses on chlorine residual. So this shows you what your chlorine residual was for a range of testing. Each point represents testing that took place over 14 years. You can see some very far outliers. So that already indicates to you that there were times when that system was very far, very, it really did not meet water quality standards at all. You notice a cluster towards the bottom, but still there is a wide variation. I'm not sure if you can make out, there's a red line right around the second point on the vertical axis. That would have been where you would want most of your water quality data to adhere to fall very close to that area. But then you see that it falls short. Most of your samples fall very short of that. So this kind of trend data, it comes after the fact, but it helps to paint a picture that makes you realize that some of what you see can be linked to water quality. Now I say can be because at present, the way in which water quality data is collected and the way in which epidemiological data is collected does not allow for correlation, and that's one of the things that this study plans to assist in addressing. Okay, another thing that we did within this system description is to look at the perspective of the consumer. So there were a number of focus group meetings that took place in Olio, Denerive, Tomaso, and Denry. And representative communities that received water from these water systems were asked to come in and explain, to describe what their experiences were. How they stored water, how frequently they got water, what was the condition of the water, what they used it for, how they augmented the supply, and that became important. A number of people were using surface water sources, so water sources from rivers that were downstream of agricultural activity, downstream of housing, downstream of any number of other activities. They harvested that water when they felt they had no choice. During drought, after the hurricane, when the supply was interrupted. And that water was sometimes mixed with water that they got from trucks that hauled water into the area, water that they harvested from rooftop catchments with no treatment, and water from spring sources in the area. Now I'll come back to spring sources in a while because that's a particular issue. So again, in meeting with people, we were able to identify what it was that they did, which also further compromised in the first place the kind of water that they received. So, and again, that is part of the importance of water safety planning. That falls outside the scope of WASCO. Once they get water to you in your pipe at home, their job is done. What you do with that water, whether you store it in a tank on your roof that you probably never clean, or whether you have it in an wide open faced drum that you access with a vessel that may or may not be clean and may be exposed, whether you have animals that can access that water inadvertently, or children might play in it, or organisms that can get into that for breeding purposes and contaminate it. All of these are issues that had to be explored. And that's where the Ministry of Health comes in. When we see cases of gastro, one of the things that was expected is that There will be questions asked about the source of water, where do you get your water from when you start to manifest these symptoms? Where do you store your water? Who has access to it? How recently did you consume it? That sort of thing. So that's why I made reference to the fact that because of how the data is collected, we can't correlate data from epidemiology with data from water quality. Okay, so quite a part, and that just wraps up what the description was. So again, we're describing everything that related to the physical hazards, the physical area, right down to the consumer and how they manage, store, and access their water. In Module 3, we're looking at hazards. What are the hazards? By the time you finish with your description, you can pinpoint. You can segregate according to catchment area, treatment, storage, distribution, where your hazards exist. Once you've done that, your hazards can be identified as physical, chemical, or microbial. Now this was done, this is actually extracted from the WSP document that we're putting together as part of this pilot project. What it does is that it identifies what the hazards are and it gives it a ranking of significant, insignificant, or unknown. Now there's a more complex numerical calculation to do that. But in the first instance, it was felt that that was a bit challenging. We didn't have everybody involved in the process who could very clearly make those kind of interventions. So in a workshop setting, we just simply asked for persons, particularly with expertise in the area, to just give us a general idea of whether some hazard that we could identify was significant or not, or the degree of significance. Okay, so in further iterations, when you're looking at when we have greater expertise, more confidence, and greater experience dealing with water safety planning and further versions of it, we can look at a numerical calculation that would perhaps be more accurate. But for our purposes, we thought that it was more important to get people to just get involved and start to think around what's important and what's not. So this is what it would have looked like. Based on the catchment, abstraction, treatment, distribution, storage, and we also looked at the household level and haulage. Now, haulage is important in Dennery because in some areas there is no water. Water does not come through taps. So the water has to be hauled in trucks. These trucks are supposed to be certified. They're supposed to be cleared by WASCO. They're supposed to be cleared by the Ministry of Health. They're supposed to obtain a license. They're supposed to be checked to make sure that the water that they carry is safe and clean. But we also have opportunistic haulers who do not adhere to these things. And that is one of the hazards that was identified when we were going through this process. So people are not sure where they're coming from, where they get their water from, how safe it is. Okay, so again, we went through this, we identified the hazards, and then the likelihood of these hazards taking place, so we identified risk. Okay, I'm going to be talking very fast from now on because apparently I've expired my time. Okay, Module 4 looks at control measures. So control measures really builds on what we would have had before. So once you've identified your hazards and your risks, your next thing is to identify how you deal with that. What do you do to lessen that impact? And then beyond that, what you do to make sure it's effective. So the bulk of a water safety planning document just looks like a series of tables that go across a page that just build from strength to strength, identifying hazards, what you do, how you verify, how you deal with it, right down to level of responsibility. Who does it? Who is it sent to? Who is it reported to? Who deals with that? And outcomes. Module 6. Oh, sorry. Yeah, so Module 5, again, as I was just saying, it really comes down to identifying your control measures and making sure that it forms part of a plan. Once you get to Module 5, that's probably where you start to look at investment. What do you need to do to fix this problem? Which is the most urgent problem? How is that going to be dealt with? Is it a legislative issue? Is it an administrative issue? Is it an information flow issue? Is it a technical issue? Who is going to deal with that? How much is it going to cost? When are we going to do it by? How are we going to make sure it's working? These are all issues that we deal with at this level. So module 6, again, it really goes down to brass tacks. It really goes down to individual levels of responsibility when it comes to monitoring. Monitoring is going to play a very important role. There's no way you're going to know whether what you're doing is having any impact if you don't measure and be able to predict and be able to go back and be iterative and decide what works, what doesn't, and try something else. So water safety planning is not static. So most of this then focuses on verifying the effectiveness of your water safety plan. Now, as I mentioned before, your water safety plan is going to look very different depending on where it's done for, what area, what catchments, whether it's done in Lucia in a rural system. What is done in Supra is going to be different from what's done in Denry, even if they're both rural systems, because of the difference in topography, the difference in demographics, the difference in any number of things. Even the consumers, the sources will be different because you have more spring sources in Supra. The water is also more acidic. So all of these will represent separate issues. So going through this at that level is perhaps the most effective. Now I'm only stressing that because I've seen a water safety plan that looks at an entire country. Whereas it's a good attempt for starting something out, it's very generic and it does not allow you to make the sort of intervention that will lead to an actual improvement in water safety. Okay, so module 8 and 9 really focus on larger management procedures, development of wider support programs that will help to implement your water safety plan. And modules 10 and 11 speak to review. Again, you're only going to know that this is working if you go back and you assess it. As you make improvements 1 year, you need to review your plan to make sure that you account for that. If your technology becomes more sophisticated, as you increase your staff, as your staff become trained and more knowledgeable, you should see different types of problems. Certain problems you should not see anymore. Others might creep up, and that needs to be accounted for within your water safety plan. So at the end of this, we learned some important lessons. We saw expanded awareness and opportunities among stakeholders. I know that WASCO certainly indicated that they saw the value in this. We were able to provide them with some data about their own system that they didn't know about. Because believe it or not, there was information out there that, in terms of distribution, let's say, mapping, they didn't know where certain pipes would. They didn't know where certain distribution systems ended and others started. So this was useful because they don't have standard operating procedures that are documented. So you may have some people who work there for a long time and they're very knowledgeable, but when these people disappear, a lot of institutional knowledge disappears with them. So we saw how critical issues are systematically analyzed. We saw how data is collected and how to make data collection more effective. We looked at the Ministry of Health, the role of Ministry of Health, and I think that epidemiology in particular, I think environmental health, but I remember epidemiology indicating that they had a better relationship with WASCO after starting this process because they were actually contacted more frequently when incidents occurred. Now, I'm just going to focus on the last two issues here. These were independent studies that were undertaken as a result of the first set of work that we did. We realized that during the drought and after the hurricane, because there was this interrupted supply, a number of persons were resorting to spring sources. Now, the issue with spring sources is that the water looks clean, often. The water looks clean, and the perception is that it's clean water, so people drink it. In fact, people drink it preferentially. People with a supply at home and access to spring water within close distance, they will consume spring water. But not all spring water is clean. In fact, after the hurricane, some springs turned out to be runoff from septic systems. Again, it appeared clean, it appeared clear, but it wasn't. We did some sanitary survey work. Some work was done by Professor Neil Morgan of MIT, where they actually went out, found some of these springs, did the testing. We went in and we did some assessment of the sanitary areas, of the sanitary surveys of these spring areas. And in some of them, there was garbage. You literally had to walk around. There were bottles, there was garbage strewn in those areas, and people were still accessing the water from there, even when they did not know what the quality was. So one of the things that came out of this was to address the issue of spring sources, maybe signage, maybe in more information, or identifying those sources which are very good quality and which can be used or should be used for wider public consumption during times of emergencies. And finally, a draft audit protocol. The Ministry of Health requested that as a step in assisting implementation, and what this would do is to assist them in being able to audit what WASCO is doing. From a water safety perspective, it will assist them in being able to make sure that they adhere to certain quality issues. Okay, so the big issue moving forward is about mainstreaming. It's about getting this water safety plan to be adopted and to be applied in other areas. Now, it sounds like a big undertaking, but baby steps. These things can be done in small steps. Some of these issues are about sharing information. It's about being in contact with other agencies that have information that can assist. It's about ensuring sustainability and replication, putting that in writing, and we'll use with other agencies so that you have that interaction, that information flow, and allowing for that to be incorporated into the standard operating procedures of various agencies, especially WASCO.